Good day everyone, I'm Rachel Ekabanban and today I am going to perform the NGT feeding gavage. So for the equipments, feeding formula that is prescribed, calibrated glass, asepto syringe or 50 ml syringe, bowl with hot water, stethoscope, medicine glass, towel or napkin, 60 ml of water, then alcohol and gloves. So for the preparation, pour the specified amount of prescribed formula into the calibrated glasses. So the physician prescribed 120 ml. Then next is place the glass with formula into a bowl of hot water. This will take a few minutes just to warm the formula that I am going to formulate later on. The next is check the temperature of formula by dropping a small amount over the dorsum of the hand. The next is arrange all the needed equipment on the tray and bring to the patient bedside. The next is introduce self and verifies the client's identity. Explain the client the procedure, why it is necessary, and how the clients can cooperate. So, good evening ma'am. I am Rachel Ekabanban and today I am going to perform the NGT feeding gavage. So by checking the client's identity, we need to check on her wrist. The next is perform hand hygiene and observe appropriate infection control procedure. Then by using the alcohol. The next is provide for client's privacy, places clients on the moderate backrest. So client's privacy. The next is put protective towel or napkin over the patient's chest. Then next is we should wear gloves. The next is unclog NGT. Before unclog, we need to kink. Then unclog. Attach the tip of the syringe to the free end of NGT. So we need to push the bulb of the syringe. We need to push and slowly aspirate the gastric content. Another technique of NGT is that auscultate over the left upper quadrant for vowel sound before each feeding. Places the diaphragm or bell of the stethoscope over the patient epigastrium and listen for gurgling sound as slight pressure is applied at the bulb of the asepto syringe. So using the stethoscope, then we need to aspirate. So So apply already the pressure. So I heard already the whooshing sound. That means to say that the tip of the NGT is inside the stomach of the patient. The next is assesses abdominal distension or tenderness and for residual feeding content. If for follow-up feeding, aspirate the gastric content and measure the amount before administering the feeding. Whenever to remove the asepto syringe, we need to kink the tube so that the air will not be entering. So, we need to kink, then remove. The next is return aspirated content to the stomach unless the volume exceeds 100 ml. This is to prevent the occurrence of the electrolyte imbalance. Maintain the clients in semi-polar position. And recheck residual in a hold, or it depends on the physical or physician's order. The next is kink the tube. Kink the tube. Then, and remove the bulb of the asepto syringe. And pour the formula into the barrel. So we need to pour 30 ml of water. So now we will already to give the formula to the prescribed to the patient. Then the next is pour the formula. While pouring the formula, we need to kink the tube. So we need to kink the tube, then pour. Then release the kink of the tube and allows the formulas to flow by the gravity. Then keep the barrel of the asepto syringe about 8 to 12 inches above the patient. Raises the barrel a little higher or applies gently pressure on the bulb of the syringe. It formulates falls to flow freely. So if the flow of the formula is too slow, elevate the asepto syringe. If it's too fast, lower the asepto syringe. Then ask if the patient is comfortable while infusing is flowing. Then assess for the presence of fullness, cramping, nausea, vomiting, and diarrhea, which indicate the distension of the intestine. So when the patient feel abnormal feelings, we should stop the feeding immediately. Then next is flushing the NGT with 30 to 60 cc of water once the prescribed amount of formula is consumed. So, why we need to add again a water? Because this will flush the remaining formula to the tube. So we need to kink again the tube, then pour the water. Then the tube before it becomes completely emptying the detached and asepto syringe. Plug the, then we need to run the water. The next is plug the end of the NGT with its own cover. If none, If none, we will use the clamp. The next is keep the patient in moderate back rest of another 30 minutes or more, then turn the patient to the right. So why we need to turn to the right the patient? So to prevent backflow of the formula that has administered. Then remove the towel. Cleanse and keep the equipments used. Then next is remove the gloves. Then next is place it on a basin. Then perform hand hygiene using the alcohol. The next is document the type and amount of formula given and untoward reaction of the client. So next is observe for possible complication and problems. That's all. Thank you.